All right, I just got called to the scene for a gunshot wound. Seems like we got one patient got shot in the chest. So yeah, we're gonna go check it out. All right, so I pull up to the scene. The scene seems to be safe. No more armored assailants, and I put on my PPE, my imaginary PPE, my gloves and what have you. So we're going to be dealing with some blood in this situation. And I arrive and I look at my one patient, assuming I have one patient, and I am going to consider to request additional EMS if necessary. And I believe it is necessary. So if available, I will request that additional assistance. And I am going to consider stabilization of the spine, because given with a gunshot wound, you may expect some sort of fall after the shot, and that could lead to some spinal injuries. So I would have my partner hold manual C-spine for the time being. And as a general impression of the patient, they're going to be in some serious distress. They just got shot in the chest, so this is already a high priority patient for me. So I'm going to try to move very swiftly. And yeah, so I'm going to go up to my patient and I'm going to assess my ABCs. So they seem to be, the airway seems to be okay. They are breathing, but the respirations are extremely fast and labored and very shallow. So immediately I'm gonna assist them in ventilations via bag valve mask. And so get their breathing right, and then I'm gonna assess the circulation, assess the pulse. The patient also looks very pale and sweaty, compensating for shock. We got extremely high pulses, pretty bad cap refill. So we got a patient compensating for shock here. And yeah, so this is a very high priority patient, so I'm gonna transport immediately and move on to my secondary assessment. So I'm gonna start palpating for additional injuries besides, well, before that, I would actually address the gunshot wound in the chest. I would use an occlusive dressing for this sucking chest wound here. You know, tape that down on 3 sides. You know, make sure it's not sucking anymore. And then I would move on to palpating the patient. So I'm gonna start with the head. Look for any additional things. Go down to the thorax, neck, look for any irregularities. Look at the mouth more, the nose, ears. Move down to the chest. You got that one gunshot wound in the chest. Go to the abdomen. Roll in your hand. Check out the pelvis. Everything seems to be okay. And then move down to the lower extremities using opposing pressure on the femur and the tib fib. And then move up to the upper extremities. Check out those clavicles. Opposing pressures. The patient is slightly responsive, responding to this stimuli. Okay. All right, and then after doing this assessment, I would take some vitals. I'll start off with a blood pressure. So we got a blood pressure of 150 over 100, extremely high. The pulse is also extremely high and irregular, and the respirations are still very slow and labored. So I would transport this patient immediately and reassess the vitals every 5 minutes upon transport.